So CNM-Au8 novel therapy. Essentially, it's a suspension of gold nanocrystals. Each dose contains about 1.2 quadrillion nanocrystals, and these are both brain penetrant and cell membrane penetrant. So they get into all cells in the body, including neurons. And the proposed mechanism of action of this drug is to enhance the cellular energetics. Essentially, the surfaces, which are faceted, clean facet surfaces of these nanocrystals, act as a catalyst, primarily in the conversion of NADH to NAD+, and by doing that, by improving that ratio, will result in more ATP in the cells. And ATP is, of course, the primary energy source of most of the cells, including neurons. So the idea is to improve cellular energetics in neurons that might be susceptible to death in a variety of diseases. MS is the topic of interest in the visionary MS study, but in across a broad spectrum of other neurodegenerative disorders. So visionary MS is a phase 2 study in patients with relapsing multiple sclerosis who are stable and have chronic optic neuropathy at baseline. And the idea of this therapy is to see whether or not we can promote remyelination and potentially axonal function improvements in a patient group by treating them with this drug. So it was a placebo-controlled trial. The double-blind period was for 48 weeks, and the long-term extension data, it takes patients out to about 3 years of treatment altogether. And the main outcome of the study, the primary clinical outcome, was a change in low contrast letter acuity from baseline, so a clinical measure, and then there were paraclinical measures to support improvements in visual function, namely multifocal visual evoked potential, amplitude and latency. That gives us an idea of axonal function and myelination status of the optic nerve respectively. And in addition, there were non-visual outcomes that speak to the more global effect of the drug, namely measures such as cognition with the SDMT and other measures such as time 25-foot walk, etc. So the long-term follow-up essentially showed the same trends we saw in the earlier study, but showed now significant improvements to baseline across a range of both paraclinical measures and clinical measures. Paraclinical measures are the ones I spoke to before. Firstly, evidence of remyelination, namely a reduction in the latency of the visual evoked potential. So in other words, faster conduction consistent with remyelination. Improved amplitude, which was for me an unexpected finding of the visual evoked potential, which spoke to improved axonal function. And namely the primary outcome of the double-blind phase, the low contrast letter acuity, continued to improve over the course of the study and remained significant out to the end of the study. And similarly, we saw changes that reflected that same trend with significant benefits over baseline for SDMT as well. So we have now a range of paraclinical measures, clinical measures that have improved over this study. Now it's a small study, it's a phase 2 study. It was conducted at least the double-blind phase during the pandemic, so it didn't recruit to the same level we wanted. But despite that, I think it's a remarkable study in the sense that we've got not just paraclinical measures, but measurable clinical benefits that corroborate those changes. Personally, I would love to see a phase 3 study. I think there's more than sufficient data there now to justify a phase 3 study. You know, these results have provided incredible impetus for that. But that's a question for Clean Nanomedicine, and obviously I'm sure they are looking forward to a phase 3 study, and we would love to get that off the ground as soon as we can.